Hello, everyone. Our apologies for the technology issues for some people. I know some folks had a lot of buffering and other people did not. So we're going to try to work on a solution for that for people who participated in this session, but we don't want to delay the conversation. And hopefully the sound was good enough for you to still kind of get the gist of what was happening in the movie. So without any further ado, I want to further introduce our panelists today and get into our conversation. So I mentioned Frances Mills, who's over the Cleveland Office of Minority Health. And I just want to read a little bit of her bio, which says, Frances provides leadership and oversight of the Cleveland Office of Minority Health and the Healthy Cleveland Initiatives, whose programs inform, educate, and empower individuals, organizations, and communities on chronic health issues impacting persons of color. She is a doctoral candidate at Ashland Theological Seminary in transformational leadership and has a Minister of Divinity with a focus in practical theology from Ashland. And then Katrice Cain, who is the Racial Disparities Program Director at First Year Cleveland. Katrice works to examine and address the impact of race, ethnicity, and racism on health outcomes. Her work involves examining systems, programs, practices, and policies through an equity lens. For the past 10 years, Ms. Cain has designed and conducted culturally appropriate programming and research studies. She has a BA in psychology from Kent State University and a Master of Arts degree in clinical mental health counseling from John Carroll University. So welcome, panelists. I know that was a mouthful, but I just want you to know that we have some experts here for this conversation. And I want to open it up to Frances to kind of frame the conversation with the first question being, what is the impetus for creating toxic and what does it have to do with sustainable communities?
Well, that's an easy question to answer. In 2017, when this work started, we were seeing across the city and the county as well an increase in the number of infants who died before their first birthday, particularly African American infants. And because Healthy Cleveland is the health promotion arm looking at how can we raise awareness and promote good health practice, good health education for the residents and organizations and collaborators in the community, we were asked by leadership of the health department to really focus on infant mortality. All of our Healthy Cleveland committees, health literacy, our Breathe Free committee, our Healthy Neighborhoods Committee, our Healthy Eating Committee, each committee was asked to focus their work on some aspect that would assist in raising awareness about infant mortality and developing programming and solutions around reducing infant mortality for African Americans. And so it came to our committee and we wanted to look at doing a short film that would really highlight the reality of women who are accessing OBGYN care. What is their lives like? What is the African American woman experiencing as she takes that pregnancy and birth journey? And so what we did was we had some good ideas based on the data that we knew about, but we wanted to hear from women. What has your experience been like, particularly women and families who had lost infants? And so we went on a listening, fact-finding mission to collect their stories. As we began to collect those stories, we began to hear some very disturbing information about their experiences. Not only had families lost children, but the way that they were treated along the way was really problematic, because infant mortality data tells us that the typical thinking about, well, this is an issue in which children are dying because mothers are not getting prenatal care, because mothers are poor, because mothers are single household heads. This is probably contributing to the poor outcomes of their babies. Well, in reality, we knew, but we also confirmed that this is a issue that transcends income, it transcends education, it transcends poverty. It's not just poor Black women, it's all Black women, it's highly educated Black women, it's highly incomed Black women, it's two-parent households. All of these families are experiencing infant loss at alarming rates. And so, as we heard those stories, we were able to, as a committee, a phenomenal committee, to sit down and identify those issues and begin to talk about those things that impact health outcomes, but also impact what happens to a woman when she enters a system for care. And so we begin to look at the intersections between race and chronic stress and how those two things come together and impact birth outcomes. What do women experience in terms of microaggressions in the workplace? And we begin to commit all of those ideas down on paper. And we had the privilege of working with a funder, First Year Cleveland. The Pregnancy and Infant Loss Committee was our funder to really refine our script, which was a diamond when we started out. And we began to buff and polish that diamond and were given some additional resources that not only allowed us to complete the work, get the work funded, but also to create additional educational tools in the form of a film discussion guide in order to begin the task of educating the community, not just the community at large, but particularly our healthcare community, about the challenges that Black women were facing.
And can you connect a few dots for our audience just in terms of how this relates to sustainable communities?
Well, in terms of sustainable communities, you have to have people in order to have sustainable communities. And so the impact on the human capital and potential that happens in the community that certainly sustainable systems would be interested in, a devastating impact happens every time a child dies, every time a Black baby dies. When we looked at the long data, what did this look like over a 5-year period? We lost almost 500 children, lost potential, children who would not thrive, children who would not develop, children who would not go to school, become contributors to society. And so when you talk about sustainability, you have to have that human capital in order to go forth. And when something erodes that human capital, then it becomes a sustainability problem.
And we hear a lot now the phrase of a health equity culture. Can you unpack that a little bit and just define what that is and why it matters?
Well, sure. It's three things, really. It's, what do I believe about equity? What do I believe about it? Do I have values pertaining to an idea about equity? And just to be certain that when equity people talk about equity, whether it's health equity, whether it's equity in education, equity in criminal justice systems, we're talking about racial equity. And so what do we believe about equity? What do we believe about what people should be able to aspire to, achieve, negotiate? And then the second thing, what do we believe that is expressed in terms of values, but what do we show for that in terms of policy? Do we have written policy, written protocol that tells us how to respond in certain situations as it relates to inclusivity, as it relates to diversity, as it relates to who we do business with? And so then the last thing is, what are our practices? Are we able to practice what we said that we believe and what we have codified on paper? And so it's a process of embracing that idea and that value, adopting a practice, and implementing that practice, and then going and saying, have we done what we said we were going to do? So anytime a culture of equity is activated, you're looking at some very specific things around inclusivity in terms of who has voice, who doesn't have voice, who's at the table, who's not at the table. Are my actions, how are they going to impact people? Are they going to benefit people? Who are they going to benefit? Is it the action going to harm people? And so who is it going to harm? Will people that we say need resources, will the actual people get resources? A lot of times you'll see people confusing two terms. They'll confuse equity and equality. Equality means that everybody gets the same thing. Equity focuses on who needs what, and are we able to give the people who need that thing the most, are we able to get that resource to those individuals? And so sometimes when we're operating an equitable system, there are groups of people who might not need everything in a package, but there are other groups of people who will need everything in that package and then some. And so the goal of equity is to get people what they need.
Thank you. And I can say, having been a part of the Healthy Neighborhoods team, that even in the production of the movie, First Year Cleveland really pushed us to make sure that we applied an equity lens to the production of the movie. And to say, like, a lot of times we'll say, well, we have Black people writing the script, we have Black people in the movie, but they don't get any of the money. And they were like, nope, if the Black people don't get some of the money, then it's not happening. And I really appreciated that perspective, because that is what is needed. You have to put the talk into action. So I want to just turn over to Katrice now and just ask if you could speak a little bit about health equity as it pertains to what we saw in the movie, and just give a little stats for our audience in case they are unfamiliar with the infant mortality rates.
Good afternoon, everyone. I think Francis set it up quite well. Really exactly what we're seeing as far as inequities. When we talk about the data, this issue around infant mortality has been persistent for over 50 years in Cuyahoga County, way too long. So that's over 5 decades. We've had one of the highest infant mortality rates in the United States, particularly even higher for our Black babies. We know that in the United States, Black babies die 2 times the rate as white babies. In Ohio, Black babies die 3 times the rate as white babies. In Cuyahoga County, Black babies die as high as 4 times the rate as white babies. And then in the city of Cleveland, Black babies die as high as 7 times the rate as white babies. And as Francis mentioned, that this is across socioeconomic status. We know that Black women with advanced degrees have higher rates of infant mortality, of pregnancy and infant loss than white women with less than a GED. And we are looking across systems and sectors around this issue, that we know that the root causes of infant mortality, the underlying root causes, is contributed to racism. It's interpersonal, institutional, and systemic racism. So we have to look at the legacy of over 400 years of racism in our country and how that has permeated the lives of Black and Brown individuals and communities. Every aspect of their life has been permeated as a result of racism. We begin to look at our practices, our policies, our systems, people who are put into place to make an executive decisions. All of that has been rooted in racism and has transcended over the years. So it's important that it's not just an issue around healthcare. And as Francis mentioned, this is, with our employment, our housing, our education, our public safety, our criminal justice. So you have to understand the full scope of this issue around infant mortality, that people don't live in our healthcare systems, in our hospitals, but they live in their neighborhoods. They're experiencing things in the workplace, on their job, in their schools, when they're traveling in their neighborhoods. So it's really about the full scope of what is a day in a life for a Black woman as it relates to these high infant mortality rates. And that's why this film was created. Oftentimes we don't humanize our data. I just shared with you the data that we have nationally in the state of Ohio, in our county, in our city. but it's important to put a face to that, to see, you know, what's behind those experiences when we talk about infant mortality. What did this individual and her family experience on a day-to-day basis, which has contributed to toxic stress, that contributed to some of the inequities that we see in their health outcomes. So I am so, you know, honored and privileged and thankful to be a part of this project and to work with Francis and Danielle and the Health and Wellness Committee and the Pregnancy and Infant Loss Committee, because this is what this work is about. We cannot provoke changes if we don't truly understand the issues that exist and the voices and the faces behind these issues.
Thank you. And I see that Deepa put the link in the chat for the Pregnant and Infant Loss website, so you can get more information about all of the resources available, the ways to get engaged. But what I want to do right now is turn the conversation a little bit more broadly onto sustainability and ask Francis if you can just unpack what viewing your work through an equity lens looks like. You're on mute, Francis.
Thank you. When we apply an equity lens, just continue the conversation with the first question. One of the things that we like to hide behind is that term diversity. Okay, diversity is who's at the table. And so we have to ask that question, who's at the table? But then a secondary question in applying equity lens would be, are those individuals who are at the table, are they everybody that we need? Are they inclusive of communities who are impacted? Oftentimes we deliver services, we provide programs, and we do things in community without truly asking people, what is it that you need? And so applying an equity lens will definitely, you will see an element that has a very strong community engagement element to it. You will always go back to an affected community and say, what do you need? How is this issue impacting you? And are you willing to be a part of the planning and the execution of whatever it is that we come up with? So diversity means who's at the table? Have we closed that circle and gotten everyone to the table that we need? But also the secondary question is, do those individuals have voice? Sometimes we engage in work and we say, well, we have African American woman, check. We have Asian male, check. We have white woman, check. We have African American, check. And they're at the table. Be happy. But then they might not necessarily have the voice or the influence at the table. If you're in a situation of planning and you find that there's a meeting before the meeting or a meeting after the meeting, and those people weren't included in that meeting, then you probably have an equity issue. And applying an equity lens means that I'm fully aware of both power and privilege dynamics that happen. And so you have to, as facilitators of work, make sure that everyone is being heard and everyone is being present and everyone is allowed to express themselves as work goes forward. And so you have diversity, inclusion, you have power and privilege, but you also have, like you said, those resources. How are the resources being allocated? Sometimes, especially in government, we operate on formulas. We may identify a problem, the state identifies a problem, the federal government identifies a problem, and it says, well, we'll give this community, based on the number of people who live in that community, X amount of dollars. When there may be embedded communities who are experiencing the burden of a problem at a much greater load. But everybody got the same thing. And so these communities ought to be better because we gave each community X amount of dollars to address the issue. Now, community A may not have needed any resources at all because their burden of the problem was not even manifest, while agency X bears all the burden. They have individuals who are impacted severely, but they only get the same amount of money that community A received. And so those are things that have to be addressed. And then the last thing is benefits. We come up with ideas and we fail to ask the question, who is benefiting from this decision? And if the people who are benefiting from the decision do not match the people that you're trying to help, then that's a problem. And so then that means we have to go back to the table and look at how do we create solutions that will actually benefit the people that we are intending to impact with this issue. And then will our action cause harm? Are we actually going to harm someone when we make this decision? And how do we address that? And so an equity lens is a commitment to asking those questions and taking those actions that will enable all people to achieve the highest level of whatever it is that we're trying to address. If it's, are we trying to address good health, then all people will be able to have what they need in order to reach that goal.
Thank you. You said a lot in that statement. And we have come to learn that the Office of Sustainability has a equity plan. I know that because of the declarations of racism, the city and the county are coming up with plans. But I want to ask Katrice if there's anything more you want to add in terms of what's essential in terms of implementing that plan, because there's a process that happens just to create it, but then there's actually the implementation of it.
Yes, that is correct. I first want to start saying that this work begins with yourself. It begins with ourselves. We have to examine, as Frances mentioned earlier, I think she said, is what do I believe about equity? And I think that everyone has to take that time to truly think about their beliefs around equity, around racism, around some of these key issues. We see even in the film that Nina's coworker says that nothing good comes out of Kinsman. Well, where did that belief stem from? You know, where do we have these stereotypes and these perceptions? Where are they rooted in? And often I think that people, you know, they have these thoughts and feelings. They come up in meetings, and we begin to question how decisions are made if someone feels this way about the communities we are serving. So we have to start there, and ask yourself: do you have similar thoughts and feelings about our local communities? You know, do you feel that nothing good comes out of it? Do you have a negative perception of our neighborhoods? Maybe it's not that extreme, but really figuring out what are your thoughts? You know, what are your beliefs when it comes to the work that you're doing around sustainability? Do you truly know our local communities? Are you driving by daily and passing through for work-related purposes only? We have to really take the time to understand the assets, the beauty in our communities, the history in the communities, the people that make our communities who they are and what they are. Instead of focusing on the deficits, the many challenges, it's easy to focus on the negativity, but we need to focus on the strengths and the assets and the beauty of our city and our surrounding cities and communities. And then also being mindful of when you hear conversations, when you're in meetings and someone says something similar to the conversation that we heard between Nina and her coworker, what do you do? What do you say? Are you silent in that moment? You know, what are you thinking and feeling? We talk about microaggressions, we talk about biases, we talk about assumptions, and we don't realize and we don't recognize the fact that this happens on a daily occurrence in meetings, in workplace banter, inside conversations, in emails that people will make remarks and no one does anything, no one says anything, no one addresses this. And what does it do for those who are going to be negatively impacted by those comments? And what does it do for those who are listening that know something's wrong, yet they don't say anything? So I think we have to be mindful to create those safe environments for people to come forth about their experiences. for people to feel that they can talk about key issues that are impacting our communities beyond just our typical work, daily work associated topics. And always remember that silence and inaction perpetuate racism. So we can no longer be silent on these matters and issues. That if we hear something, that we have to be bold enough to say something to address it, to lead to change. I think that the plans are good, but you have to think beyond a piece of paper. You know, I think with everything dealing with what's happening in our country right now, the social injustice, you know, people talking about racism as a public health crisis. There have been statements that have been made, there have been plans that have been developed, but what's really behind the piece of paper? Do you have a plan and action of how to execute this work? And who would hold departments and offices accountable for making sure that this work is implemented correctly in an equitable way and in a sustainable way? So those are important things I encourage people to think, whether you have already drafted something or you're in the process of it. It has to say, what will this look like? How will this impact? How do we move these words into action? How do we really stand behind what we intend to do? And that will help build trust within your organization, within your department, but then also within the community. So we talked about it before, having shared common language about what equity is. That's very important. I think we all have different definitions at times, but working with, we have Frances right there, who's leading this work within the city of Cleveland, who's taking the charge and leading this. I think we have to truly make sure that our definitions are shared, that it's clear, that everybody can communicate this in meetings and presentations and say, this is what equity means and this is what it looks like to us, and be able to communicate that. We talked about including people at the table, making sure that there's representation, that there's inclusivity, that we mean it though. It's not tokenism, it's not check boxes, but you really make sure that they have shared power, decision making, that they feel safe, that they feel heard, that you understand that this is a collaborative effort, you know, especially when we talk about infant mortality. This is not a healthcare issue. This is not, well, that's their problem. This is a community issue. It's happened for way too long that our babies have been dying. So we have to take ownership of this. And we have to realize and recognize that racism is a reason for this. So that we have to take ownership and say that we have some issues around racism in our communities. Let's not shy away from it. Let's not ignore it, but let's be ready to take bold action to address it and to dismantle this racism. It goes back to, as Frances mentioned, examining policies and practices and procedures and programs. You know, making sure that we are willing to be open to hard conversations that we may need to have, that we are willing to be transparent, to say that whatever we need to do to make sure that there's equity within our systems, we're willing to do that. You know, it may require some changes in the infrastructure. We have to be okay with that. And maybe require some very tough conversations. We have to be ready for that. We have to be ready to be honest with ourselves, knowing that these health inequities exist. And if we're serious about addressing them, then that requires us to really take an internal look into ourselves and be ready to fix things. And then also remembering that these inequities are cross systems. So we have to coordinate with one another and not always work in silos, which we typically do. So that even goes with these equity plans and how you plan to implement them. They should align with other offices. There should be conversations. They should make sure that there is an alignment in that fact. We cannot do this separate from one another.
Thank you. So we have 5 minutes left. So I want to try to do two things simultaneously. One is to show the slide of just a couple of call to action items. People always want to know, what can I do? So we can have that on the screen so that you can see it. But I do want to ask if there are any burning questions. We have time to answer maybe one or two of them. Were there any in the chat, Deepa, that you want to put forward?
I have not seen many questions yet, Danielle, so maybe we can probably share the call to action while we are sharing. Expect the attendees to ask more questions.
Okay.
Well, I see some popping up from Judy. Do you want to go for the questions?
Oh, can you tell us some best practices in Cleveland to help communities get healthy babies? I'm going to leave that one to Katrice to start us off, maybe.
Sorry, okay, so I would say that, you know, through the work of First Year Cleveland, our collective impact model, it has shown to be effective. We have some really great organizations, you know, Moms First, we have Birthing Beautiful Communities. So they're working together to make sure that we address issues related to premature births and to sleep-related deaths, and making sure that we connect our families with home visitors and doulas. That connection, that grassroots efforts of making sure that families have support throughout their prenatal, birthing, and postnatal journey is important. It's vital. It helps them. You have that education piece. You have that support piece. You have someone there to help them through some of the challenges that they're dealing with personally, that they may also deal with professionally in their lives. As I mentioned, you know, we've been talking about this as across socioeconomic status. We have to make sure that there's things in place to support not only the mother, but the father as well. So we have excellent fatherhood programs within the city of Cleveland that have been there to make sure that the woman and the baby's entire village has some type of resources and can connect it to the support that they need throughout this entire journey. So I feel like, and Frances is more than welcome, please chime in on what you think, but I think that has been something that we've seen to really decrease the infant mortality rates. We are very data driven. We are making sure that, as we've been talking about, that we listen to the voices of those who've experienced loss. We're doing a lot of work within the healthcare systems to address racism and bias. So those unified efforts, I think, are contributing to some of the decrease that we've seen, especially since First Year Cleveland was first established, but knowing that this is not just the work of First Year Cleveland, that there are phenomenal organizations and partners who have collectively come together and say that we are going to work to address this crisis that we have around our babies dying before age 1.
Double click on the box call to action. It should maximize on your screen. We only have 2 minutes left, so I do want to ask Frances if you have a parting statement you want to make, because part 2 of that question was, what about families and communities in terms of what are best practices?
Well, one of the things I might add, collective impact is certainly, you know, the goal that we've been working toward and continue to execute, but the strategies themselves, we call them upstream strategies. It's not just that what's underneath children dying. You know, sometimes that's housing issues, sometimes that's workforce development issues, sometimes it's a birth spacing issue, sometimes it's a smoking issue, sometimes it's a racism issue. And so while our focus remains certainly firmly on racism, there are other social determinants of health that we're looking to address. And so one of the things about First Year Cleveland and our involvement, it's not just simply about programs, it's about what can we activate within systems to bring about the best outcomes for women and families. And then just in terms of tying it all together, you know, this understanding that equity work, it's a process, it's not an event. And so while it is important, what we're seeing right now in this country is a phenomenal outpouring of, I think we're almost up to 50 cities across the United States who have declared racism as a public health crisis. It is so important to name it. And so I think we're in that naming phase, but we can't leave behind what Katrice said about, this is about implementation. It's about work. It's about doing the work. You name it, you make the statement, you do the work, and you understand that it is an unfinished work that we will continue to focus on for many decades to come.
Thank you both. I just want to thank Katrice and Frances again for being our panelists. Thank you, Deepa, for inviting us here to this important conversation and making the link with this movie to the efforts in sustainability. And I believe I saw in the chat that people can connect with us on the People tab. We have our bios in there. If you have future questions, feel free to reach out to us.
Thank you so much, Danielle. Thank you, Katrice and Francis, for a very thought-provoking conversation and a most, very timely conversation and discussion on this topic. And for more discussions and related topic for our equity, please make sure that you check your schedule and join us for the discussions on water equity that's happening in Breakout 2 and food security, insecurity, Breakout 5. And we also have energy equity discussion that will be happening tomorrow, and many more discussions happening today and tomorrow. Please feel free to check us if you have any questions of the organizers, and we'll be happy to direct you to those panels. And once again, thank you very much, and I hope you continue to enjoy the rest of the day, attend as many panels as possible. Thank you very much.
Bye, everybody.